Hello everyone and welcome to Locator Locum webinar, how to manage delivery drivers in your pharmacy. There's a couple of people still joining here, so usually what we do is we give it about a couple of minutes just to let people join, and then we'll go through the housekeeping and we'll go through the agenda and the introductions and things. So just give it 30 seconds and we'll then get started. You can see some familiar names in already. Good evening, Richard. Nice to see you in. Thanks very much for attending. Appreciate it. We'll just get started then. I just don't want to keep anyone any longer than we have to. So welcome to the How to Manage Delivery Drivers in Your Pharmacy webinar. I'm Stevie McIntyre. I'm the marketing lead here at Locator Locum. Joined by Jonny Clarke, who's the CEO here at Locator Locum, and Jeanette Haire, who's the healthcare lead here at Locator Locum. So just start by housekeeping. There's questions box at the bottom. Please feel free to put your questions in there throughout the webinar, and we will get to those either at the Q&A section or just as we go along if it's very pertinent to the subject we're talking about. We also have the chat function, so I'd really encourage everyone to interact with each other. I'm just writing in the chat now, hey, so if you're on the webinar, feel free to do the same. And then we'll also have interactive polls throughout the webinar, so this will be a chance for you to give your opinion on things we're talking about and really shape how we move forward with post-webinar. So just while people are still coming in, just to let you know, we have a whole series of webinars coming up. The next webinar is on the 6th of May, and it's the impact of IR35 for employers, which is another really topical issue. And then the next one after that is on the 10th of June, and it's how to reduce locum costs. And I'll be looking at the rates and all the other studies we've done and taking data from the platform. And then also post this event, I will be releasing a PDF covering all the content that we've gone over in the webinar. And also we will make some referrals of technology to use, other companies to look at. And then also I mentioned on LinkedIn group that we intend to give a CPD certificate to everyone who's on the webinar as well. So that's a little bit of a value add for you. So yeah, again, just encourage everyone to put their questions into the chat box or the question box. And without further ado, I'll hand over to Jonny to do the first slide.
Thanks, Stevie. Good evening, everyone. Welcome to this evening's webinar. I'm here just to welcome you all, really, and give a background to the company. You may or may not know, I'm actually a qualified pharmacist, and the company really started, firstly, to my first-hand experience as working as a locum pharmacist, and then secondly, working as a pharmacy manager in a pharmacy, trying to manage staff and book locums around time that I was off. This slide depicts really Locator Locum's mission and vision, and it is our vision, to mobilize the world's healthcare workforce. And that really means that, as a company, we believe in a future where our technology will ensure we get the right healthcare professional to the right place at the right time. We do a lot of good work in pharmacy, but over the previous 12 months, we've also branched out at the pharmacy market and also service a lot of private care homes also. It's actually, exhibit similar challenges to within pharmacy. The next slide will just give you an overview of our product split. And firstly, just to bring your eyes to the right-hand side of the screen, and that's our Locum marketplace. Typically, that's what we're known as in the pharmacy industry. We started life as a Locum supplier, and we call that our marketplace. We have between 12 and 15,000 locums now, providing services to pharmacy right across the UK and Ireland. But tonight in the next series of webinars is all around, communicating that we as a company are really so much more than that, locum supplier. We have a suite of software tools that really allow pharmacists to get back to what they're good at, reducing time spent on, unnecessary administration, and then maximizing that time to get right in front of patients. So starting from the left-hand side of the screen, you may or may not be aware, we actually have a Rota product. that enables pharmacies to easily create and share rotas right across their organization. That's not just pharmacist staff, but their whole staff and suite. And this evening's webinar is all about actually how you can utilize drivers within that mix also. We also have a leave module that easily allows employees to request leave, which automatically updates the rota. You know, we're aware of the responsible pharmacist regulation. You know, to be open, a pharmacy has to have a pharmacist. Our solution's smart that when pharmacists request leave, it automatically flags a gap, and you can choose actually to place a locum there or another member of staff. Our bank product enables our customers to really build their own pool of temporary workers. That could be their own suite of direct locums, or that could be, for tonight's example, actually you know, a pool of temporary drivers that you can facilitate shifts with. And the beauty about using the platform is that if people are working, you know, particularly locums or staff, they need to get paid, and our expense management module really streamlines that whole process, not only to around hourly payments for shifts, but actually also ancillary payments such as mileage. Really excited to share that we had a new feature, which is time and attendance, that we're now rolling out to our customers. And that really ensures that staff do arrive on site at the right time. Staff effectively clock in to their shift, and employers get full visibility of maybe patterns such as lateness. And last but by no means least, we have a full reporting suite. We have a suite of about 30 standard reports right across the platform. And that enables, you know, anyone that works with us to get the most out of their data. You know, in business, there's a lot of decisions to be made, and you have to ensure you're making the right decision at the end of the day. And our reporting suite ensures really that 100% of all the decisions that you make in your business are data driven. I'm now going to pass back to Stevie. He'll just give you an overview of tonight's webinar.
Thanks, Jonny. Yeah, so obviously the title is How to Manage Delivery Drivers in Your Pharmacy. This really was born out of some conversations we have with current clients and prospective clients, and just in the industry in general. It was something that people said there's challenges around managing drivers, and it really provoked a lot of discussion. And then we followed up by doing some polls on through our LinkedIn event, and there were some really interesting things that came out of that around the challenges, and we wanted to really showcase how our software could help that. So the agenda is pretty simple on the things I've said there. So we're going to look at the challenges and some discussion points, and then we're going to do a quick demo on software that could help help overcome those challenges, and then we'll do a Q&A. So we don't expect the webinar to be over 45 minutes. So please interact as much as possible on the chat. And we're going to start by getting a gauge of how you guys are, what you guys want out of the webinar. So we're going to do a quick poll. So you should see a poll pop up in your screen in any second whenever I press launch. And then if we just give it under a minute to let you guys vote on that. So yeah, so I'll just read it out. What are the challenges with drivers, scheduling, ensuring efficient deliveries, mileage and expenses, driver supply, or other? So we'll let that run for 10 more seconds, and then we'll close it off. Go. Thank you very much, everyone, for voting. Much appreciated. Yeah, I'll close that off now. 100% of the people have voted. Great work. Okay, so I've closed that off now. We'll be working in the background with that, and at the end of the webinar, this may dictate some of our discussion points of the Q&A. But without further ado, I will hand over to Jeanette, who's going to take you guys through the challenges and discussions that we've gleaned from speaking to clients over the last few weeks. Jeanette,
hi everyone. Good evening. Basically, as Stevie mentioned there, we have found that by speaking with various different clients, current clients that are using the system and also potential clients, there's many challenges faced with managing drivers, and there's various different things, but three that really come out and stood out from it was around scheduling and working patterns. You know, managing shifts if they work maybe full-time, part-time, some are employed, some are self-employed. Visibility of drivers, so seeing when they're actually working, when they've clocked in, when they've clocked out, and expenses. And I was actually talking to a client recently who his drivers send him a text when they're finished, and it's usually when he's bathing his kids at 8 o'clock at night or whatever, and he has to remember, right, I must put that information down. So it's adding additional pressure onto what is already a very pressurized role. And then cover as well, and we've had clients who have obviously increased the amount of drivers that they had due to COVID and due to the demand, and they're still struggling even with short-term cover or even covers for holidays. So what I want to do today is take you through Locator Locum and how our software manages drivers. And it'd be great, obviously, as Stevie's already mentioned, if you've got questions, please do fire them through and I can answer them as I'm going along as well. So the first thing I always like to kind of highlight is that Locator Locum as software is a cloud-based solution. So what that means for you guys is that you have visibility from anywhere with an internet point, effectively. And you can access it on a mobile phone app or on a desktop. So you don't need to be in the pharmacy to view it and to update it. It's also live. So what that means for you guys is it's one source of truth. And this is something that comes up time and time again when you're using Excel spreadsheets, when rotas are changing constantly. You're having to send out updated versions, which can obviously cause issues with communication on maybe where drivers are meant to be and what routes they're meant to be doing and so forth. So our solution enables you to put every employee onto one rota. And that's another issue that has come up where drivers are managed separately to the rest of the pharmacy. By having everyone on one rota means you're able to see exactly where everyone is, who's working and where. And our solution enables you to look at the rota from the likes of your date ranges. You can look at it on a day, week or month view. You also have the ability to look at it by location. You can look at it and filter it by job and also filter it by labels, which I'll discuss in the next slide. Just put it across. Oh, here we go. So as you can see here, this is just one location. So this is Dell Pharmacy, okay, and we've got a couple of drivers in there. The two scenarios that seem to come up, and you can maybe agree or disagree, and you may have a completely different scenario to this, but most people seem to work either where the driver is routed in for a shift, and they have a specific time and they clock in and they clock out. Or there is pharmacies that work on the basis where drivers kind of pick when they're in and they're self-employed, so they'll come in maybe for a couple of hours and they'll notify the pharmacy of their hours of work and their mileage. The system can cope with both of those very easily. But what we're going to look at today is those drivers that are routed into the system that have actual shifts and how Locator Locum can actually manage that for you. So what you can see here, you'll have various different shifts put in, different times. You'll also have a little tag here on each where you can actually tag a driver to a particular route. So if you work on routes, you're able to actually put that in. And then what the route enables you to do is you can filter as well by your routes to ensure that you're actually covering all of those as and when you need them covered. So with that, you're able to obviously book the shifts in. You'll see here on the right hand side, it will calculate how many hours the driver is actually working for you, which will then feed into the payroll report later down the line, which I'll discuss. But it will also let you notify the driver. So when you book a shift for that particular driver, it will notify them when they're working, and it will also tell them their route, which you'll see here with the R1 or R2 and so forth. So it means that you're communicating that without actually having to pick up the phone or spend time WhatsApping. It's sent through to him through the, or her, should I say, through the Locator Locum app. And further from that is that most, or say for instance, some pharmacies may use a generic system, okay, for scheduling. Some use Outlook, some use spreadsheets, and various other different solutions. Our solution is a truly pharmacy-based solution. And what that means is that we have developed a system that will work with the scenarios of a pharmacy. So in that, it will flag up if you have gaps. So as Jonny mentioned at the very start here, you need to have a pharmacist there to open your pharmacy. We've elaborated on that further, where you're actually able to search your rota and to compare and make sure that you don't have gaps for all roles. So be that pharmacist, be that a technician, dispenser, driver. Okay, they're all included. And what you're able to do, so if I look, for instance, at the date range here at the top, you'll see locations, and I want to look at my drivers. I can then look for gaps in drivers. And you'll see here through all my different locations, it will flag if there are any gaps. And what this does is it obviously alerts you, first of all, that you've got a gap and you need to fill it. But by selecting that D on the rota, you can either assign a shift to a driver. So if you know there's someone available, you can put them in. So it may be a relief or someone you know that's not working. Or you can post that gap out to all your drivers and notify them that there is a shift available and would somebody like to pick it up. That's all done with one click of a button, really. So you're not having to spend time, as I mentioned already, picking up the phone, WhatsApping, trying to get cover in between doing all your other jobs that you may be doing. And this is what the Locator Locum app looks like. So from the employee's point of view, they have their own profile, and they'll store information on that. So you can actually store things linked to their profile, likes of driver's license, insurances, things that you need to know about them. And it will all be stored in one central place. You also have where they're able to see their shifts, so what's up and coming. And the actual rota as well, if you wish, they can see that too. A big benefit as well is that the driver can also request leave through the app. And what this does is, if they request leave, it will notify the branch manager of the request, and they can then view and see if other drivers are off. So the system will actually notify the pharmacy manager, for example, of anyone else that's off. And then from that, they can decide to either approve it or decline it. If they approve it, that will drop the leave directly into the rota for them. So they're not having to think about, oh, another step, I must go back and put that leave in. But they can also, if they need to decline it due to maybe other drivers being off, they can also put a little message in to say, I'm sorry, I can't give you this. We're already understaffed with drivers today or whatever. So again, you have the flexibility with that. But the big thing that I've kind of found from feedback with staff is that they really actually love having this app, because they're able to actually, plan their work-life balance. I know obviously at the minute with COVID, it's quite kind of limited and people aren't making very many plans, but that will obviously change, and they're able to actually say, okay, well, we can plan to do X, Y, and Z in a few weeks, go out for dinner, hopefully, without having to wait until they're back in work to check, because it's all there for them. Another big benefit is that you can actually clock in and clock out with Locator Locum. So I've heard where drivers, for instance, may sign a little book when they come in and sign back out in a different branch to let the staff know what their hours of work are. With Locator Locum, what you're able to do is the driver can come into branch, they can sign in using their employee number or an email address, and pick up what they need. The pharmacy manager can also send messages through this. So, for instance, if they need them to speak to them before they go out regarding a patient, for instance, the driver is able to see that too, which is great because they might be busy with the patient at the time and may not be able to grab them. They also have the benefit of when they clock out, they can do that at any branch. So it may not be that they're going to be at the same branch again. And also with that, they are able to put their own notes in too. So what they can do is they can put in their mileage, for instance, so 62 miles today. And what that means from your point of view is that everything is stored in one place. So you're not looking at a sheet where they've signed in. You're not looking at a spreadsheet for their rota. And you're not looking at a text message, for instance, with their mileage on it. It's all in one place and you can always go back to it and check. With the time and attendance module, if, for instance, a driver doesn't check in, and it may be that they've come in and started speaking to somebody, or it may be that they're running late, the driver and also the pharmacy manager will be notified that they are late for their shift or they haven't clocked in yet. So again, you can set the times of when that should be. It could be 5 minutes after shift, or it could be 15 minutes after shift. And the same happens as well at the end of when they're clocking out or due to clock out. And this ensures real accuracy with regards to payroll and making sure that you have all the information that you need. So you're not 3 weeks down the line looking and thinking that driver never clocked out. Does anybody know what time he finished at? You know, it's easier to kind of highlight that information and find out the truth of what time they finished at when it's within a 24-hour period as opposed to maybe a 3-week period. And this is what an actual driver timesheet looks like. So you'll see their shift times and their breaks and things like that. But what you'll also see is some exclamation marks here. And what this is abnormalities. So for instance, this driver was late. They should have been clocked in at a certain time. So it might have been 9 o'clock. But they've clocked in at 11 minutes past. So do you want to deduct that time off them? And you have the ability through the actions here to decide what you want to do. And it could be as well that they worked overtime and you do want to improve that. You were aware that they had to work extra time. There was an accident on a motorway or whatever, and you can improve it. And that's no problem. And what this does is this will then feed automatically into payroll for you. So again, you're not having to think about it. You're not manually collating that information. The system is doing it for you. And it's a real known fact. Google it if you wish. But if you manually record information for payroll, you have an error rate of between 1% and 8% of your total salaries. So that's huge when you think of a monthly salary of all your staff. And so even if we look at a 1%, the manual process is just not, using a system is going to pay for the errors alone, really. And then, as I mentioned, this obviously feeds into payroll. So this is where we have a full reporting suite, as Jonny mentioned earlier, within Locator Locum. And I'm a big believer in if you can record the information in Locator Locum, you can pull it out. So if there's a particular report that you need that we don't have, then that can be bespoke to your specific pharmacy, no problem. You can set your own parameters, so the likes of date ranges, so everybody's payroll might slightly differ. You can look at regions, you can decide what should be paid, what it should be deducted, and what is unpaid. And then the system will calculate that for you. And what you're able to do then is export that out into either a CSV to send on to payroll or an Excel spreadsheet if you want to manipulate that further. So again, all of this is reducing the amount of time it takes you to manually collate this data, but also takes the pressure off you having to remember to collate all this information and just makes everything more streamlined. And really the big thing that I get from clients, especially at the minute with everything that's going on, is yes, I really want a system. I know I need a system, but I just don't have the time to do it. I don't have the time to set aside to set up a new system, get everybody trained. And I totally get it. We all get it. So we provide a full onboarding service whenever you buy Locator Locum. It's part of the package. So we offer you a dedicated customer success manager. And what that person is basically the person that holds your hand until you're set up. So they will make sure that you have all your data migrated across, that it's all in the right formats. They will ensure that your training is provided, be that on site or online, and we can offer both. And then what we do is we don't just give you software, make sure you're set up and hope everything goes well. We will sit with you and have, 15, even 10-minute calls monthly, just to kind of get your feedback on how you're getting on with the system, but also to update you on developments with us. We are continually developing this system, and we want to ensure that we stay as market leaders within the pharmacy industry. So we want to hear your feedback and for you to help us develop our software further. And you don't have to take my word on all this. Amy Gordon is one of our clients from Right Medicine, and she uses Locator Locum to manage her drivers. And as you can see here, she has a mix of challenges. So hers are, she has employed and self-employed drivers, admin time associated with the drivers as well, which hopefully you can appreciate as well with regards to scheduling and payroll. And what she found is that she was able to reduce her admin time by 2 hours, at least 2 hours per week, just on admin. So she was able to get on with other things that were probably a lot more important. But also she was able to ensure 0 payment errors. So for instance, she could be saving a minimum of, a couple of £1,000 a month managing her drivers within Locator Locum. And that's all I would like to show you today, or this evening, should I say. Obviously, if anyone wants a more personalised or detailed demonstration, do feel free to get in contact and we can get that organised as well. That's back to you, Stevie.
Yeah, brilliant. Thank you very much. That was a very comprehensive overview of the platform, and hopefully provided some value for you there on how Locator Locum can help with drivers, and we've looked at some of the challenges that you're facing. I think it's interesting that I'll just actually share the results of the poll there. I think we covered everything that was suggested in the poll. And then one of the questions, so here's the results. So what are your challenges with drivers? 40% scheduling, 40% ensuring efficient deliveries, and then 20% drivers and driver supply, which is an interesting one. And someone's asked, Laura's asked, can you help us get drivers? So Jonny, do you want to take that one?
Yep, I will, Stevie. So it's something that we've looked at before, but unfortunately, we think we're not best suited to actually supply drivers to pharmacies. And the reason for that is there's a lot of checks that would be needing completed, such as vehicle checks and stuff, alongside that. We actually think there's other people in the industry that already do it quite well. And it's just to highlight the resources you're going to be sharing out in post tonight's webinar. We'll actually include links to that. So if you are looking for maybe short-term delivery drivers to join your pharmacy, we'll share links to companies that can help you with that.
Brilliant, Jonny, thanks. The questions are flying in now. So Daniel's asked, he asked firstly, whenever you're presenting, Jeanette, what if there's no cover needed? Then he expanded on it, and he put a scenario out there, and I think it's a really interesting one. What if a driver is on annual leave on Thursday, but the deliveries can be picked up on the Wednesday and the Friday, so they can cover all deliveries they need to do on the Wednesday and the Friday? So that there's a gap in the rota, but there's actually no necessity for a driver on that day. Can the system deal with that?
Yeah, it's completely up to you how you utilize your gaps. The system is there to flag up that there are gaps, but if you know that all deliveries are being covered, then you can just go about as normal. Yeah, or remove it if you don't either.
Okay, brilliant. Hopefully that answers your question, Daniel. If it doesn't, fire another one in or expand further, and we can delve a bit deeper into it. Richard has asked a question, not sure who wants to pick this one up. Is there plans for drivers using their own vehicle to be able to enter mileage the same as the way locums can, for instance, now?
I'll leave that one to Jonny.
Yep. Yes, there is. We're thinking of doing that in a number of different ways, but the smartest approach actually is the expenses function, which locums primarily get the most benefit out of. We're going to extend that really to all employees, and pharmacies can choose actually which employees can access that. So drivers would be able to use that and then track mileage accordingly.
Okay, brilliant, Richard. Hope that answers. Again, if it doesn't, fire us an email straight after or pop in the chat box if we're not done. Richard, there's another one from you. So I think he's kind of covered this one. Also, are there plans to introduce locum drivers so we can open up options? Did you just cover that, Jonny? I think slightly.
Yes, that was more back about, you know, whether we ourselves will create a pool, and it's something, you know, we're happy maybe to pick up with Richard, you know, directly. But we believe there's other people that we think in the industry that are ready to do that and offer an efficient service. And there's maybe 3 or 4, Richard, that will point you in the right direction, you know, to follow up with. It's not simple to start a driver supply pool, for example. As I said, there's a lot of checks even to do with vehicles and whatnot that are really outside our control. We have had a success, you know, in pharmacy and certainly supplying locums and pharmacists, and there's a lot of work to be done within that arena before we actually even go out and build out, you know, a driver supplier pool. So at this point, we would rather point you to other experts in the industry.
Brilliant. Thanks, Jonny. Another one has come in there. We don't employ drivers full time. Is there the ability to schedule drivers on 0 hours contracts?
Yes, there is. So you can put in drivers, and then you can decide as and when they're you need to book them for a shift effectively. So they can be on a 0 hour contract. There's no problem.
Okay, perfect. Amanda has got a question. We have our drivers shifts in Lal for payroll. What else do we have to do to allow drivers to use the extra functionality in Locator Locum? Not sure if we picked that one up now, Jonny, or?
Yep, I think that's Amanda, maybe from Nights. There's a couple of things maybe that we can schedule in the next catch up, Amanda. Firstly, would be ensure that the whole Nights team are making use of the labels, you know, like Jeanette showed here, actually around tagging. And then secondly, we can do further training, you know, around the clock-in. We're providing a further update to the clock-in where drivers can actually include notes maybe as part of that, and that might actually also help and add into Richard's question, where that's another option where drivers could actually log mileage into the system. But we'll schedule a second catch up with yourself, Amanda, to run you through to make sure you're getting full benefit from the system.
Perfect, Amanda. Hopefully that has you covered. There's no more questions in there. Oh, one's come through just there. How long would it take to get set up with drivers on your platform?
To get set up with the system, we can turn you around as quickly as you need to be turned around. So we can have you going within a week of sign up.
Okay, perfect. Simple answer. Amazing. That to be all the questions. If anyone's got any while I'm running through the closing bits, feel free to pop them in and we can jump back into the questions. Hopefully everyone found that really useful. And I think Jonny said at the start, we'll be sharing a whole email of resources post-webinar. There'll be CPD certificate for everyone, and we'll cover all the content in a PDF. As well as that, I will be sharing the recording, so you can share it with your team or anyone else within your pharmacy who's involved with the drivers. You can even show the drivers the app on the recording. So yeah, and again, thank you all for attending. It was a really interactive session tonight. And we also have 2 up-and-coming webinars, which I'll also share in the resources that you can register for now. Jonny, Jeanette, anything closing you want to say?
No, thanks so much for attending tonight. And as I mentioned already, if you want a more detailed demonstration and more personalised one to your particular scenarios, do get in touch, and I'd be happy to take you through that.
Yep. Same for myself. Thanks everyone for taking, a part of their evening up, to come on here. Really, really interested in the feedback you provide on these webinars. We really want them to be useful. We've even had current customers come on here and maybe find updates to the system. So please do, complete the review, and we look forward to working closely with you to build out the system even further.
Yeah, I would just echo what Jonny says. It's not a dictatorship here. If anyone's got a subject for a webinar that they think they would love us to cover, we're more than happy to put the research in and put it together for you. So yeah, open to all the feedback. But again, I just want to say thank you everyone for attending. So I'll close it down now. Thanks very much.
Thanks,
Bye.
guys.
All right.
Bye.